Hi, I'm Maribel Reyes.
And I'm Morin.
And we are the first Schweitzer Fellows to establish this project.
Anyone who proposes to do good must not expect people to roll stones out of his way. A direct quote by Albert Schweitzer. Our project focused on improving chronic disease outcomes in farm worker communities through Spanish language health education on hypertension and diabetes. This work is especially important because chronic diseases like hypertension and diabetes disproportionately affect underserved and farm worker populations.
We collected baseline and post-intervention data, including blood pressure and pre- and post surveys, assessing health knowledge and confidence.
Participants demonstrated increased understanding of blood pressure goals, medication use, and warning signs requiring medical attention. Survey data showed a significant rise in confidence navigating the healthcare system and managing their own conditions. Clinically, we observed encouraging trends in blood pressure control and among patients who were able to follow longitudinally, reflecting early but meaningful changes in disease management.
Participants began asking informed questions, advocating for themselves in clinical settings, and sharing what they learned with their families.
This project reinforced that education, when culturally and linguistically accessible, can directly translate into measurable health outcomes. And we are honored to continue this work as Albert Schweitzer Fellowship Fellows.